Okay, let's unpack this. Today we're doing a deep dive into breastfeeding protocols, specifically positioning and latching.
Mm-hmm.
We're digging into guidelines from places like Toronto Public Health, all based on evidence-informed practice.
Right, solid stuff.
And our mission for you really is to pull out the key insights, the actionable stuff from these guides so you can understand the core principles for, well, comfortable and effective breastfeeding.
Yeah, and right off the bat, these guidelines stress something important. Pretty much any position that works for you and baby is okay,
As long as it works.
as long as it's comfortable and crucially allows for effective milk transfer. That comfort and good alignment, that's what sets the stage for a really good deep latch.
Okay, so why is getting that positioning and latch right so, I guess, foundational?
Oh, it's absolutely essential. I mean, it helps the baby feed efficiently, ensures they get enough milk to grow.
Yeah.
It stimulates your milk supply, keeps it going, and really importantly, helps prevent those common painful issues.
Like sore nipples.
Exactly. Sore nipples, mastitis, that's a breast infection, low supply, maybe slow weight gain for the baby. Getting the latch right helps avoid a lot of that.
Makes total sense.
Yeah.
So when you're actually setting up, what are the core principles for positioning they highlight?
Okay, first thing, your own comfort.
Yeah.
You need to be relaxed, well supported, use pillows, whatever works.
Right.
Then hold your baby close, really close. Think tummy to mommy, unswaddled is best, skin to skin if you can.
Okay.
And here's a key visual. Imagine a straight line from their ear, through the shoulder, down to the hip. Keep that aligned.
Ear, shoulder, hip. Got it.
And this is vital for the latch. Make sure the baby's head is tilted back just slightly, kind of like they're sniffing the air.
Ah, the sniffing position. I can picture that.
That little tilt brings the chin forward onto the breast, which helps open the airway and encourages that wide mouth for a deep latch.
Interesting. Now, you mentioned positions. The guidelines talk about something called biological nurturing.
Yes. Also called laid-back breastfeeding. It's fascinating because it sort of flips the script. It really leans into the baby's own instincts.
How so?
Well, you lean back, semi-reclined. Gravity helps support the baby on your chest, tummy down, skin to skin.
Uh-huh.
This position naturally triggers the baby's innate reflexes, like rooting, finding the breast, and even self-attaching. Their little stepping reflexes can help them crawl towards the breast.
So the baby is doing more of the work.
Pretty much. It often makes self-attachment easier. Babies might latch faster. Plus, it's usually really relaxing for the parent, but still gives great support for the baby. Works well for many term and even late preterm babies.
Wow.
And sometimes if there are issues like, say, a tongue tie, gravity can actually help a bit with tongue function in this position.
That's really cool how gravity plays a part there. So, okay, once you're positioned, the next big step is the latch itself. What are the principles there?
Right. So besides good positioning, you want your baby calm but alert. Not super fussy, not too sleepy.
Makes sense.
Bring the baby to the breast, supporting their shoulders and neck. But here's a key tip. Don't push the back of their head.
Why not?
You want their head free to tilt back into that snipping position. Pushing the head can actually make them pull away or tuck their chin, which makes latching harder.
Ah, okay.
Guide their nose towards your nipple. Use it as a landmark. When their chin and lower lip touch the breast, that wide open mouth reflex should kick in, like a big yawn.
And that big yawn is what you're aiming for.
Exactly. You want them to take in a big mouthful of breast tissue, not just the nipple. Chin buried in the breast, bottom lip way below the nipple base.
So it's not symmetrical.
No, ideally it's asymmetrical. You'll often see more of the areola, the darker area above the baby's top lip than below the bottom lip.
Okay.
That asymmetry helps get the nipple positioned comfortably deep in the baby's mouth against the soft palate, which is key for comfort and effective milk removal. Sometimes shaping your breast gently, the breast sandwich idea can help.
Breast sandwich, right. So how do you know if it's actually working? There's that checklist, right?
Yes, the LATCH acronym. Super useful. L is for lips. Are they flanged out like fish lips?
Okay.
A is for asymmetric, more areola, showing above the top lip. T is tummy to mommy alignment. C is chin, is it touching the breast with the nose clear? And H is, have a listen and watch. Can you hear or see swallowing? Is the suckling rhythmic?
LATCH. That really breaks it down clearly. The guides also mention troubleshooting and other positions briefly.
Yeah, they do. They stress that lots of positions can work: cradle, cross cradle, football hold, side lying. But if you're having trouble, like pain or feeding seems slow, reassess everything.
Check the basics again.
Exactly. Check the positioning, check the latch. Small tweaks like making sure the head is tilted back or adding pillow support can make a huge difference. And for multiples, they suggest maybe mastering feeding one baby at a time first.
Before trying tandem feeding.
Right. Then you can explore things like the V-hold or double football hold, just making sure everyone is well supported.
Okay, so wrapping this up, what's the big picture here? We've covered positioning basics, the huge importance of that deep asymmetric latch.
Using the LATCH tool.
Right, checking effectiveness with LATCH. We touched on biological nurturing, breast shaping, a bit on troubleshooting, even multiples.
And the consistent message is, different positions work, but that effective latch is absolutely key. For comfort, for milk transfer, for both of you.
Absolutely. But here's something really interesting that kept popping up. These protocols repeatedly mention baby-led latching, this idea that infants have this natural built-in ability to find the breast and attach themselves.
They have that innate knowledge.
Exactly. Which makes you wonder, doesn't it? How much power is there in simply recognizing and supporting those natural reflexes versus focusing purely on teaching specific techniques?
That's a great question to ponder. How much is instinct? How much is instruction?
Definitely something fascinating to think about from these guidelines.